Hello, I'm Dr. Ashmina Khalsa. I'm the Senior Consultant Obstetrician Gynecologist at Cloudnine Hospital, Lucknow Division. So what is induced labor? The word induction means an artificial onset of labor pain. It's a condition where we are going to give you certain medicines, certain gels, tablets, even a drip to have an artificial onset of labor. Yes, there are certain conditions, certain medical conditions, certain obstetric conditions, and certain other conditions, sometimes very rarely on request of a mother, if they have a certain date in mind, for us to have an onset of labor which is done artificially. So induction can be done by a lot of methods. They can be mechanical, like we examine you, we make you lie down, and we perform something called a sweep stretch that helps me to induce. A second can be we can introduce something called a Foley's into uterine cervix and balloon it up. Again, a mechanical form of an induction. This swelling of the balloon catheter bulb allows a certain chemical called prostaglandin to be released and labor to get started. Others are medical forms of induction where we introduce gels vaginally once in every 6 hours. We can insert tablets. The similar tablets can also be given to you orally, where you are drinking it like a normal tablet, or we can have them placed under the tongue. Other forms of induction can always be an IV line where we have a medicine given into the drip. So what we are achieving out of induction is just an artificial onset of pain. You can always ask, so how long does it take? Every individual is separate. So before we start induction, we perform something called a Bishop scoring. In this scoring, I'm going to assess how pliable, how soft, how conducive your cervix being the mouth of the uterus is, which will respond to my medication. A poor Bishop score will always have higher chances of failure of induction. However, a Bishop score of 6 or more than 6 will have excellent chances of having induced and having labor to be started. So my idea of induction is onset of labor. Once your labor begins, I will be augmenting your labor. That is, enhancing the pain, enhancing the process of labor with certain medications. Induction is a relatively safe process if done properly, if done thoroughly, following the guidelines. However, we must always keep in mind a patient undergoing induction has to sign a consented form, has to give her obstetrician the consent to take her up for an emergency delivery in case she feels exhaustive, in case the fetal heart drips, or there are other features of fetal distress. Those are indications where we have to terminate induction and take you up for an emergency cesarean section.